All right, 2 Texas residents who are aboard a cruise ship linked to hantavirus outbreak are now back home and monitoring themselves for symptoms.
So joining us now to better understand what all of this means is the director of the Dallas County Department of Health and Human Services, Dr. Philip Huang. Thank you so much for being here.
Thank you. Yeah.
When we talk about the virus, can we just level set? Because we get a lot of comments, a lot of concern, like nobody wants to go through another pandemic.
Sure. No, this is very different from the pandemic. I mean, it's certainly very serious and we're monitoring it, but it's a very isolated situation at this point. It's really not a threat to the general public. But again, the people who are affected, it's a very serious situation.
And when can these 2 people that we have here in Texas who were on this cruise ship, when can we consider them in the clear for the virus? Because I imagine you have to wait a little bit to see if any of the symptoms occur.
Right. The incubation period for this hantavirus is about 1 to 6 weeks. So after 42 days after their last exposure or after they've disembarked from the ship, then they would be considered clear.
There are multiple types of this virus, right? But there's a specific strain that was found on this cruise ship. How dangerous is this particular one?
So this is the only one that, like there's 53 different strains, but this Andes species is the only one that has been known to have human-to-human transmission. So it is, very concerning from that standpoint. But still, it requires very close contact.
Mm-hmm. Okay. And so we know that health organizations, they're working to contact trace passengers who disembarked from the boat. How different is that tracing exposure to maybe tracing COVID-19? It's probably a little bit more difficult, I would imagine, just because maybe you're not always seeing people or, the symptoms aren't always known right away. Got to look at the passenger list. Well,
it's actually, this is a common practice that we do in public health all the time. TB patients, STIs, like persons diagnosed with HIV, syphilis. So, it came up during COVID and it seemed like this new thing, but no, this is something public health does all the time. And so this is part of our investigations. Our disease detectives interview the patients that, have developed the illness, identify any contacts, follow up with those persons, notify them that they've been exposed, but it's anonymous where that exposure came from. And then depending on what the agent is, monitor, and in this situation for 42 days after that last exposure.
Dr. Huang, what worries you most when you hear about some of these rare viruses back in the headlines and being transmitted again?
Well, again, I think none of us want another COVID-19 situation, and that's what we worry about. But it's, again, making sure that we are able to control it and break those chains of transmission. That's what the contact tracing does, is sort of prevents further spread. But this is what we do every day in public health. And again, when we're successful, then it's quiet, and it's not till these sort of episodes that people start thinking about what we do.
Talk to us, just we have probably time for one more question here. We know this is in Texas. You guys aren't monitoring any patients at all. Have you all been in contact with the state about maybe where these patients could be, or any sort of info you're sharing with each other?
We are in very close contact with the state and with other health departments across the state and also across the country. So everyone, the public health network is very attuned to this and working to prepare the communities.
All right, Doctor, thank you so much for being here this morning, talking to us about hantavirus and obviously the concerns surrounding it. Obviously, right now, the thing to pass along, concern should be very low at this point.
Right. To the general public, it's very low concern at this point.
All right.
Thanks for coming in.